Okay, this is Dominic Hurst again. You are familiar with me after a year of watching my videos and participating in seminars. So today my task is just to introduce you to what we're going to do in year 2. Excuse me, I'm popping things up here. I'm afraid I'm unable to be with you during your first week back at term, so hence this video, but hopefully it shouldn't be too much of a problem. So, what are we up to this year? Well, first of all, what I want to do is just to recap what we did previously, and then I'll just go briefly through the plan for year 2. So, last year, what we learnt, we learnt how to use evidence-based dentistry and why we use it. The rationale that if we use evidence, we, in theory, make better clinical decisions with our patients. We learnt about how different studies can help us to answer different questions, and therefore choosing the right sort of study is critical to getting the best answer. And we learnt how to develop a structured question from the clinical problems that we encounter, the PICO format that you all did so well with in your assignment. And we learnt how to search for studies. Again, some of you did some really good work on that. So this year we want to now go further and from the evidence-based dentistry point of view, we want to look at how we develop your critical abilities to evaluate the research that you do find. It's all very well asking a nice structured question and finding lots of research, but what you really need to know as a clinician is whether the research is useful to you and whether or not it is a well-conducted study and therefore a low risk of bias. So one of the main aims this year from the evidence-based dentistry point of view is to develop a critical approach to reading the literature. That critical approach actually ought to also spread out to how we appraise other sorts of evidence, including perhaps books that we read, or when we speak to experts or to colleagues, or we ought to also be having a critical mind about how reliable that information is. Now, what we're also doing this year is introducing you to some more sort of dental public health components. Evidence-based dentistry is principally concerned with what we do as clinicians in our practice, not only that, and it's quite closely linked to dental public health, which is more concerned with population level research and planning. So understanding rates of disease in a population, understanding how we might prevent it on a large scale, how we might manage and treat it. So within that framework, we want to introduce you to how there are gaps in the oral health within our society that lead to inequalities. And we also want to introduce you then to something that we touched on last year, which is how we actually go about screening populations for disease. As you recall, last year we mentioned that screening gives you a cross-sectional image of, say, the prevalence of prevalence of a disease within a population, and can be very useful, therefore, for planning interventions to try and improve people's well-being. And then towards the end of the year, the aim is to try and get you ready to integrate your evidence that you're finding and you're critically appraising, to integrate that with your clinical practice. So how are we going to do that? What's the sort of content that we're going to deliver? One is several sessions around what we call critical appraisal of different studies, whether those be systematic reviews, randomized controlled trials, cohort studies, screening and cross-sectional studies and surveys. So we're going to practice that. It's a skill, learning to critically appraise. It's like any other skill. Practice makes perfect, and we need to get you rehearsing that and doing that on a regular basis, so that you're then prepared for when you get into practice. We're also going to introduce this year searching for guidelines. We want to be able to help you identify collections of systematic reviews and primary studies that are called guidelines. These are developed to help us as clinicians, so that we don't have to go and look at all the primary studies and so on. But we need to be able to find them, and we actually also need to be able to critically evaluate those as well, because some guidelines are done well and some are done badly. So we're going to be introducing that in the spring term. And then, as I say, we're going to introduce you to dental public health, what dental public health is, and how we measure health inequalities within our society, within the populations that we serve, and also develop your understanding of screening as a method of helping with that. And then in term 3 or in term 6, the summer term, as you're learning to use your clinical skills and you're learning how to cut teeth and diagnose caries and this sort of thing, what we're going to do is to introduce something called an educational prescription, which basically takes the different stages. We'll recall that there are different stages in evidence-based practice, and it helps to formalize that in a way that helps you find evidence, critically evaluate it, and then decide whether or not it's something you want to use yourself in your clinical decision making. Educational prescriptions are going to be very much a part of your clinical practice and something you're going to have to get a hold of, because it will be assessed on a regular basis as part of your case presentations once you're into your clinical studies. So how are we going to deliver this? Well, last year you'll be quite familiar with the fact that I did a lot of pre-recorded lectures, and then use the time available to us face-to-face to do the seminar work, the group work. There was a lot of very positive feedback about that from last year, and so because critical appraising is a skill, it's something you have to do and it's something you need help to do. There's no point in just giving you lectures on that. We have to really do the seminar work. So in order to make this as efficient as possible, I will record lectures that'll go on QM Plus in the weeks before we do these sessions, and you'll be expected to look at them again. And I hope you know those of you who didn't last year will have learned that looking at those lectures is a good thing to do, so that you're more prepared and you benefit more from the seminars. So as well as that, there are going to be a couple of kind of live lectures that will just be introducing the different sessions. And in order to help you find the guidelines, we're going to do a search session. And finally, again in term 6 there, with the clinical guys, we're going to be doing some scenario-based learning that gets you using the educational prescription to develop your evidence-based practice skills. Assessment is usually top of students' minds, even at the beginning of the year. I certainly learnt that with you guys last year. So just a couple of points on that briefly. There will be a course unit assessment, and that will be the proper completion of an educational prescription. If you want to know what that looks like already, it is in your handbook, and you'll be able to see how I have structured the marking for that. It follows, as I said before, it follows the similar sort of principles of constructing a search, constructing a question, doing a search, but then this year critically appraising, critically evaluating the quality of the stuff that you find, and working out how you're going to implement it, and or whether you're going to implement it, what your patient's views are, what your own experiences of that. So that's going to be in term 6, that course unit assessment in the summer term. After you've learned how to do them, obviously. And then, of course, as for year one, there will be questions within your end of year exams around critical appraisal and around the dental public health topics. So I hope that has just given you a brief sort of idea of what we're up to this year. As always, feel free to contact me on my email address and throw any questions at me that you wish. And I look forward to seeing you all again towards the end of this term and beginning of next. See you then.